It got both sides.
Yeah.
Good.
Oh. Oh, wow.
Got it.
Oh, yeah.
Okay, so I have Michael here today, and he came in with his two amazing dogs. You've been to chiropractors off and on for most of your adult life,
Yes,
right?
yes.
And what happens? You get good adjustments, but sometimes you just don't get the releases you need?
Yeah, it's just I don't get the releases that I feel I should get.
Okay, so I do work probably a little stronger than the average chiropractor as far as like I go in with more intense adjustments. There's a lot of styles of chiropractor where people work super light, instrument only, tapping, little soft stuff, and I do know those techniques and I've done them when I need them, but I guess I'm really known for more, my body deeper work, so hopefully it's a good fit for you. What would you say are some of your key spots today that we need to focus on?
My neck and my sciatica.
Okay. Today, where would your sciatica be? Would it be on one side or both sides? Or?
It's mostly right today.
Right, okay. How long have you had the sciatica before, that you've been on your radar?
Probably 15 years or
Okay. And we see that sometimes, some will have herniated discs, and I saw your MRI, so you do have herniations. You also have a little forward slippage of L5, so I have to make sure I'm adjusting that correctly so it helps it not make it worse. But it's good that I got to see the report. And is there any directions that hurt worse, like when you go towards your toes or leaning back?
towards my toes.
Really? Stand right now and just see if you go towards your toes, do you notice it anywhere down?
Yeah, right here.
You're already noticing it?
Yeah.
On the right side?
Yeah.
Okay, you can come back up. Now how about leaning back? Does leaning back do anything?
It's not too bad, just tight.
Okay.
Just tight.
All right, well let's do a full body. Did you want to do the Y strap today or anything like
Yes.
that? Okay, so we'll do that too. Let's get cracking. So I'm going to have you lie face down and you're going to be on your belly. And then I'm going to start working and you tell me if you like the pressure of it. So this is something to stretch your lower back and give it a little stretch. Can you reach the second handle here? So there's a handle here and then the second one is here. The second one will give you a little bit better stretch. All right, so I'm going to, do you feel that little pop?
Yeah.
Did it feel good or did it hurt?
It was good.
Is the pressure okay or is it too little, too much?
I'm sore right there.
Okay. Right in there.
Yeah, that's where I pulled the muscle.
You pulled a muscle like 2 days ago, right?
Probably about 5 or 6 days ago.
So you got to keep letting me know if something's too strong, okay?
Yeah.
I like to work, let me describe it this way. So let's say everybody has their own scale of 0 to 10. Like yours is going to be different than mine and different from anyone else's. But if a 10 is like you're almost tapping out going, I can't do anymore, I don't want to work there, but I want to work like a 7 or 8.
Right.
And that could also be different on different days. So if I saw you 3 weeks ago, this spot might not be the same as it is today. So like just out of curiosity, that much pressure, what would you say is your scale of 1 to 10 on that spot?
About a 6 to 7.
Okay, so that's good. That's where I'd like to work. 6, 7, 8. I don't want to push it to a 9 or 10 because that would be too much for you on this given day. Now this is a totally different location here.
Yeah.
What number would that be?
About a 7.
Okay. Is that okay if we're in the 6, 7, 8 range?
Yep.
And so here's your traps, for example, up here. What number would that be?
It's like a 6.
Okay, so we're still okay.
Yeah.
Good. So you have permission to say 9, 9, 10, 10, 10, 10, 10 if one comes up, okay?
Yeah.
And that would tell me like dial it down a little bit.
Yeah.
But at the same time, we get a good thorough workout because if I only gave you 2 today, like I go, hi, this is great, Michael, you would be like, I drove all that way and he didn't do anything. So we're not going to do that either. So some people get sciatica only on one side, like their whole lives. And then some people, it could be either side, or it could switch back and forth. I would say mostly in 25 years that I've been practicing, I would say most times it presents on one side on someone. So that they'll even call me up. I haven't seen them in 2 years and they'll go, it's my left side again. They know they're like a left-sided person or a right side. It's my right side acting up again, doc. And they come in. And other people go, I tell you, I don't know. It went to the other side now. So we see both, but 90% of the time, someone really knows they're one side dominant on where the pain will be. But yours will move, right? Depending.
Yeah.
Yeah. Ooh, there's a crack. Did you hear that one?
Yeah.
Did that feel okay?
Yeah.
Okay. Like right in there's another one. You feel that one?
Yeah.
So I'm purposely looking for bad spots. I'm looking for spots that feel really super tight, that feel unusually cramped and contracted. Because if I just rushed into giving him the cracking part of the treatment, it would be short-lived because we didn't do any of the groundwork of loosening him up. So here's the upper part of the left glute. Do you get any spasms in there sometimes? Because
Yes.
sometimes sciatica will move into our glutes.
Yep.
And down into our hamstring.
Yep.
Now his right side is worse today, but he said he has got left side pain before, so I'm doing both sides because of the information that he gave me. Like here's an old knot. Do you feel that old knot?
Yep.
And there too, even worse, right?
Yep.
So would that be more of an 8?
Yeah.
So this is more intense.
Yeah.
Like right there could even be a 9 almost, right? Or 8.
Oh yeah.
Okay, now I'm on the side of the upper glute where the top of the femoral head hits the hip socket. Right there. Okay. So he's got some tough spots. I mean, these type of muscles have been tight for a while for him. Probably years, right?
Yeah.
All right, let's do this next. I'm gonna have you turn on your back and I'm gonna try to adjust in here first, okay? So we'll see if we can get a little opener here. Big breath in and blow it out. Good one.
Good.
That was a good spot,
Good,
right?
yeah.
What'd you feel?
It felt good. Nice release.
Good pops, right?
Yeah, nice release.
Good. I'm going to do a similar setup, but drop down lower in the thoracic. So the first one was T2 through T2, 3, 4, and 5. Now I'm at 7, 8, and 9. And we got one of
Yeah,
them at least
yeah.
there. Good. So I'm just working down the back. I like this position sometimes because it's still from back to front, right? Because I'm pushing up through the back part of his back towards his front part of his body. So it's still P to A or posterior to anterior, but I'm using gravity to help me. And let's go upper now. Good. All right, so some good stuff. You okay, Michael?
Yep.
Okay. Just gonna grab him down here and loosen this up. There it goes, it popped. Toes. You could hear him from over there, right? He's helping me. He wore the toe socks today. So it makes it really easy for me to get a good grip. All right, so next we're gonna have you lie on your side facing me. We're gonna see if we can get some of the lower back to release. Big breath in and blow it out. Got it.
Yeah.
So good.
Yeah.
I was hoping to,
Yeah.
you know, before we started, I was telling her as someone that's above 40 years old, if they've had chronic bad back, they're sometimes really tough to get that to pop that way. We can do it other ways with drop tables, but this one doesn't always work on people above 40 if their back's been an issue over the years. I got both sides.
Yeah, yeah.
Good. Ooh, so I'm glad about that. We're going to see if we can get your neck to move a little bit.
I like the tubio.
Yeah, we're
What's
gonna
it called, the tubio.
We're gonna do the tubio move on you, and it's everybody calls it the tubio lift. So I'm gonna come under here and let your head tilt a little bit to the left, like this way. even more so how stiff you are, right?
Yeah, I'm wicked stuff.
Wow. Okay. Big breath in.
Oh, wow.
Got it.
Oh, yeah.
Woo. Okay, it went.
Yeah.
Thank you, Dr. Tubio. Lie on your back. We're going to do a different, the other side is different, so it's not the occiput, it's lower.
Oh, yeah.
Got it.
Whew. Ooh, yeah. Good stuff.
So everything's moving on you. We got your lower back, we got your mid back, we got your toes, even though you didn't ask for that. And then your neck went with the tubio lift, and then we did a C5 on the right. So now we're gonna do just a good old-fashioned Y-strap, okay? So we're gonna do this now, okay? We're gonna pull and then give it a tug, okay? Big breath in and blow it out.
Oh. Ooh. That's tight. Wow.
So we're gonna let you just sit there for a second and let you decompress. So you did a lot today.
Yeah.
Let's see if I can find anything in his wrists. Did you hear about me through my YouTube channel, or
Yes.
did you have friends that have come in
Yes.
before?
YouTube.
And one more. So I'll see if there's a shoulder out this way. If not, we'll do some. It popped a little, right?
Yeah, a little bit.
So come back, that's the right side. So come sit over here. A little tight at the top there, right? You move it. See, do this one. Do you feel how it's tight up here a little bit?
Yeah, right there.
So I'm gonna come under the armpit and get this spot here. And this is where the lat ties in under the arm here. Those are tender, right?
Yeah, so.
Now try it.
Ew, wow. A lot more movement right there.
Yeah, is that cool?
Yeah, wow.
All right, good. All right, how do you feel now?
I feel pretty good. I feel pretty good. I'm letting it settle, you know.
All right, how about touching your toes? So go down towards your toes, see if it's a little easier now. Go a lot further, do you see the difference?
Yeah.
You can see that, Linda, right?
Yeah.
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 With less pain, right? So it's
Yeah,
not as horrible.
It's not as tight in my lower back.
All right. Thanks for watching this with Mike. And I also worked on his dogs, Kiyoshi and Karma, so you can check that out at my Animal Cracker channel. And please like and subscribe. It really helps keep the channel going. Thanks so much. And then this is the bad one right here. Got it. There, that one. That one did pop a little bit. There's the shake. That's good. And you're going to shake just by watching.